Hello. In this video, we'll discuss indications for nasotracheal intubation as it pertains to intraoperative airway management. When discussing intubation, it is not uncommon for the terms endotracheal and orotracheal tube to be used interchangeably. However, endotracheal tubes can either be placed orally, as seen on the left, or nasally, as seen on the right, to establish a definitive subglottic airway. While orotracheal intubation is more common, there are a few circumstances in which you might use nasotracheal intubation in the OR. The most common reason is that it's necessitated by the location of the procedure being performed. In head and neck surgeries, an NT tube provides a more open surgical field and can protect the tube from inadvertent damage or displacement. It is also a good backup option when oral access is limited due to trauma, mass, or swelling, or difficult to obtain due to C-spine immobilization or limited range of motion. Since nasotracheal intubation is better tolerated than oral tracheal intubation in patients who are awake and can theoretically be performed with the patient sitting up, it may be a reasonable option for patients who are unable to lay supine due to severe respiratory distress. When considering contraindications for nasotracheal intubation, it's best to first understand the possible complications. Nosebleeds are very common but can be reduced with vasoconstrictors and lubrication. Bacteremia can occur either from mucosal trauma or transfer of bacteria to the trachea during placement and may warrant antibiotic prophylaxis in some patients. There is also a greater risk the tube could become obstructed or even accidentally placed intracranially via the cribriform plate as seen in the picture below. This is very rare but can be lethal. Given these complications, nasotracheal intubation is absolutely contraindicated in patients with bleeding disorders, a history of or current skull fracture or surgery, as well as choanal atresia and suspected epiglottitis. It is also relatively contraindicated in patients with frequent nosebleeds or those on anticoagulants at risk for severe bleeding, those with an increased infection risk, such as those with the prosthetic heart valve or valvular abnormalities, and those with partial nasal obstruction.